Pals, welcome on in. How is the audio, pals? Thumbs up in the chat if the audio is good. I see you, pals. Good, perfect. Okay, thanks. How are you doing, pals? Yesterday was interesting, huh? You just kicked me off the live. You just ended the whole live. Oh, I'm going to post this on YouTube. We'll talk later. I just reposted it and I just added it to my story. I see you laughing. We are getting to 5K likes and we're going to get started. We're going to give everybody a minute. Did I send it to the speaker? You're feeling conflicted about something. Okay. That's all right. You know, welcome on in, everybody. We are grabbing our daily heart. I didn't even set a goal. Oh, there was that. Oh, isn't the Fest Pops done? Let me set a different goal. Welcome on in, welcome on in. We are grabbing our daily heart meet and we are liking the live. The short stuff, I see you. Sharella, I see you. Welcome on in. I was just setting up my goal and posting it to my story. As we're coming on in, we are grabbing our daily heart meet and we are liking the live. Once we hit 5K likes, we're going to go ahead and get started on our trending topic in healthcare. Sharella, I see you. Thank you. Am I saying your name right? Sharella, I see you. Thank you so much for your support. I have to get my tunes going for the day. Just set the vibe. I'm just trying to set the vibe up. I'm always trying to set the vibe. Mandy, welcome on in. I see you. Her Divine Alchemy, I see you. Welcome on in. Y'all know the drill. We're trying to get to 5K likes so I can go ahead and get started on my trending topic in healthcare. My speaker's not even here yet, so we good. Oh, they're not off of work yet. Welcome on in, everybody. Are they gonna make it? Welcome, 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 everybody. I see you. Lavi, I see you. Thank you so much for grabbing a daily heartbeat. Once we hit 5K likes, we're going to go ahead and get started on my trending topic in healthcare. I have a great interview, and then we're going to wrap it up with Professor Tips. We halfway there. Y'all be moving fast. Yes, ma'am. Sharella, is this your first time here? No, sure. I think you've been here before, but yeah, Sharella, we do. My office hours is a trending topic that I go over. I interview a different guest every Tuesday, and then I end it off with Professor Tips. Good evening to you too, ma'am. I see you. Let me just pull up my questions. 3.6K likes. Y'all moving fast. Just slow down. Give me a minute. Hold on. Because we getting there. We getting there. Perfect. Welcome, welcome. Office hours with Dr. Johnson. I'm ready. Are you ready? We getting to 5K likes. Once we hit 5K likes, we'll go ahead and get started on our trending topic in healthcare. Lavi, I see you using my stickers. I see you. And yes, I did add new stickers to the thing. Pals, I haven't added yet the lean in, and what was the other one? Lean in and pals, what was the other one you said you wanted me to add? C3, I see you. Welcome on in. Welcome to Office Hours with Dr. Johnson. We're getting to 5K likes. Once we hit 5K, he did his homework. Exactly. I haven't added. He did his homework and lean in. I'm going to though. I'm gonna add them. I'm gonna work on those and add them next. Okay, we getting there. We almost there. Let me lean in. And how is the audio? Thumbs up in the chat if the audio is good. I see you guys using the stickers. Okay, I see you dropping the flags. I see you. Okay, perfect. Thank you, because this... I'm ready to get started. I'm ready to... Come. Oh, you guys getting me? Oh, perfect. Y'all getting me there. You guys are getting me there. We getting there. We're getting somewhere. We are getting somewhere. We about to get to Office Hours with Dr. Johnson. Oh, I don't want to stop it. This song is good. Ooh, let me turn this up real quick before we start, because we about to start. What? This is a throwback. What y'all know about this? Okay, I see you sharing out the live. I appreciate you. Ooh, Dr. T, you made it. I almost started to get nervous, but we didn't even get started. Oh my gosh. I don't know what I was going to do. I was going to pull up somebody up on here to come. What? What? Welcome to Office Hours with Dr. Johnson. You guys are amazing. You guys are great. First and foremost, before I get started, can we give a round of applause for yourselves? Okay? Give a round of applause for you guys in the chat. I appreciate you guys continuously showing up for me and showing up for Office Hours with Dr. Johnson. And you guys have grown my platform. So it may sound cliche, but I'm just saying this from now. I'm continuing to show up every Tuesday because of y'all. And I've heard a couple people are telling me now, Dr. Johnson, your room is rooming. I can't even look at that. Like, what do you mean my room is rooming? I still get nervous when I come up on here. I still don't feel like is that Janine? I see you. Welcome on in. So shout out to you guys. Round of applause in the chat for you guys for continuing to show up for me and continuing to support me and support my movement. Because once again, like I tell you all, it's bigger than just clicks and views and engagement. I want to be a resource. I want to share information for you all. So I appreciate you guys always showing up for me and showing out. Janine, Christian Coach, I see you, ma'am. God bless you. I see you. Thank you so much for stopping by. Steph, I see you. Good evening. Welcome on in. So let's get started. Welcome to Office Hours with Dr. Johnson. Plain and simple. What y'all want to talk about? Okay. We getting serious. It's a serious topic, okay? Maybe one day I'll leave it up to you guys to pick my trending topic in healthcare. I'm gonna write that down. Janine, Christian Coach, I see you. Thank you so much for pushing out the people on popular vote. Let's jump right into it. I'm gonna write that down. Let the people them choose a trending topic for me to discuss. I like that. Let's jump right into it. So, pals, moderator, can we drop and let's shout out to one of my other moderators who messaged me and said they're on a cruise right now and they won't be able to tune in today. So shout out to them. But pals, can we drop my trending topic in healthcare? Make it a super fan park. Trending to okay. Pals, you messaged me. We could discuss that later. The potential for Formula to be overwhelmed. I just heard that. Okay, the short stuff. Hold on. Message me that. I like that. You guys are already dropping gems. I like that. You guys are. You see what I'm talking about? Round of applause for y'all in the chat. Let's continue. So, there we go. Trending topic in healthcare. Bernie Sanders proposed this past week a 32-hour work week. Can I have a couple of people in the chat drop 32 hours? Drop 32 hours in the chat. Bernie Sanders, we all know who Bernie Sanders is. So he is proposing a 32-hour work week act. Okay, what does that look like? I have my other screen. I have my resources. I'm going to share you guys real facts, real news always. Okay, we're going to breeze through what you guys know. I don't stand on my trending topic too long. I like to save it for my interview. Okay, so we're going to breeze through this and you guys are going to see how I'm going to tie it into healthcare. So the 32-hour work week act. The world has undergone enormous changes since the 40-hour work week was set by the Fair Labor Standards Act in 1940. I'm reading that slow so you guys can understand. I'm going to repeat that again. The world has undergone enormous changes since the 40-hour work week was set by the Fair Labor Standards Act in 1940. America has changed tremendously since the 1940s. Why are we still working 40 hours a week? Miss Renita, I see you. Welcome on in. So, American workers are now over 400% more productive. Can I have one person drop in the chat productive? Good afternoon, ma'am. I see you, Miss Renita. Miss Toronto. American workers are now over 400% more productive than they were back then and continue. Technological advances are likely to increase the gap between worker productivity and worker gains. Okay? While weekly wages for the average American worker are actually lower than they were 50 years ago, after adjusting for inflation, CEOs are now making nearly 400 times more than what their employees earn now. So, I see you. Who was that? Thank you so much for grabbing your daily heart me. I see you. Let's jump into what Bernie Sanders is proposing. Moving to a 32-hour work week with no loss of pay is not a radical idea. I want to repeat that again. And let's all lean in. Can I have somebody just drop in the chat? Lean in because we're leaning in. Moving to a 32-hour work week with no loss of pay is not a radical idea. It's not a radical idea. In fact, moving in that direction is already taking place in other developed countries. Other countries have 32-hour work weeks. I thought America was the land of the great. So why are we slaving off in America? Let me watch my words wisely. Because, you know, the way how my room be patrolling me. So France, just an example. I'm always going to throw you guys facts and information and resources and examples and real resources. France, an example. The 7th largest economy in the world has a 35-hour work week and is considering reducing it to 32. So France and them people there already are at 35 hours and want to reduce to 32. Why America is still slaving off for 40 hours? Let's talk about it. Drop in the chat. How do you guys feel about that as I continue? The work week in Norway and Denmark is about 37 hours a week. Do you guys hear the places I'm dropping? France, Denmark, Norway. Why in America? Big America. For my Caribbeans in the chat, you know whenever we say big, we mean big. Big America, we're still at 40 hours a week. Slaving off. Her Divine Alchemy says something about it. Yeah. So, let's continue. A recent 4-day week pilot program of 3,000 workers at over 60 companies in the United Kingdom showed that happy workers were more productive. Over 70% of workers reported greater satisfaction with their time and feeling less burnt out. That's in the UK. So you hear where I dropped. Denmark, the UK, France, Norway. Why in big America we haven't considered that? We're slaving off with this 40 hours a week, and the work can be done in 32 hours. I hope y'all know that. So let me jump right into the nitty gritty, okay? Because I want to breeze through this because I don't know how much time my speaker got. The 32-hour work week act. What would it do? What does that entail? What does that look like? Yes, Lavi, greedy. The people them is greedy. What does that look like? It would reduce the standard work week from 40 hours to 32 hours over 4 years by lowering the maximum hour threshold for overtime compensation for non-exempt employees, okay? It would require overtime pay at time and a half for work days longer than 8 hours, and overtime pay at a double a worker's regular pay for work days longer than 12 hours. That was a tongue twister. I'm going to read that again. It would require overtime pay at a time and a half for work days longer than 8 hours. Okay, makes sense. And overtime pay at a double a worker's regular pay for work days longer than 12 hours. So basically, if you're working over than 12 hours or them 8-hour threshold, you get in overtime. My blessings, I see you. The 32 Work Week Act would also protect workers' pay and benefits to ensure that a reduction in the work week does not cause a loss in pay. How am I tying this into healthcare? I'm going to tie it into healthcare. Let me show you, because it's like I always tell you guys, healthcare is collaborative. Healthcare is collaborative. I see you with the popular vote, Jackie. Thank you so much. How does this tie into what Dr. Johnson got going on in healthcare administration and healthcare overall? Many Americans are going to work exhausted. I'll repeat. Many Americans are going to work exhausted, not only mentally, but physically as well, which results in poor mental health and poor overall physical health. Bingo. Saw how I tied it in? Can we drop in the chat collaboration? Can somebody drop in the chat with me collaboration? Healthcare is collaboration. This would promote a overall better work-life balance. After somebody drops collaboration in the chat, I also would like somebody to drop work-life balance. My blessings have arrived. I see you with the collaboration. And they still want us to have children. Hey. Work-life balance. Royalty, I see you. Welcome on in, Royalty. I'm going to wrap this up. A 32-hour work week would promote a better work-life balance. Okay? A 32-hour work week would diminish the exhaustion and the exertion that we are putting on ourselves physically and mentally and emotionally. Let's throw that in there too, because that's important. Mentally, emotionally, yeah. Physically and mentally. Okay? Are we all in favor for a 32-hour work week? Do you guys all agree that we can get the work done in 32 hours? My blessings, I see you. Thank you so much for your support. Do you guys agree? In this economy, oh wait, I'm seeing comments are going crazy. Hold on. Y'all making me nervous. Hold on. Steph Shika. I hope I'm saying it right. In this here economy, pregnancy, mad, right? Having good leadership would too, exactly. Lavi said home life, definitely. Short stuff talking about work-life balance, important. Lavi talking about work-life balance, important. Hold on, I'm scrolling. They could also do a staggered schedules if they are worried about certain things getting done. Hello, that's what we do at the hospital. Hello. Janine Budget Coach, Miss the money guru, Janine Budget Coach says she agrees. All I need is a money guru to agree and I'm good. Let's continue, y'all. That was my trending topic in healthcare. We are in favor for a 32-hour work week, not because us Americans are lazy, but because us Americans, we are resourceful. We have evolved since the 1940s. That was when the 40-hour work week was enacted. 1940s, a whole other generation has born and passed and transitioned on, and we are still stuck on a 1940s act. We are still stuck on a 1940s act. So yeah, let's wrap up this 40-hour work week because I can get my work done. Give me 10 and I'm doing what I got to do. I'm going to keep it a buck. Give me 10. Pals, I see you dropping. Oh, is the Doc Wistal, I see you. Welcome on in. We were just wrapping up my trending topic in healthcare. Sephacor, I see you. Welcome on in. We were just wrapping up my trending topic in healthcare. Miss Natalie, welcome back. I'm doing well. I hope you're doing well too. Greetings, Sephacor. All of you guys who got that influx, I just jumped right in. Let me just briefly share with you. Doc Wistal, let me just briefly share with you. Transitioning from a 40-hour work week to a 32-hour work week. Do you all feel that you guys can get your work done in 32 hours versus the slavery in 40 hours? For my new people that just joined on in, that's what we're talking about. Lowering the required work week would improve our overall mental health, physical health, and promote a better work-life balance. That's all I want to come on here and tell y'all. That's my trending topic in healthcare. Okay? Don't fight the messenger. Don't beat me up. I want to jump right into my Sephacor. I see you. Welcome on in. Sephacor, now that you are here and we're here speaking live in person, you see late at night when you go live with your I want to call it sound therapy. When you go live, Sephacor, with your sound therapy, I lay down and I put the phone by the pillow. I know we're not supposed to. Don't judge me. I put the phone by the pillow, and when you go ding, 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 I lay there and just look up with the TV off and just look up and listen to the sounds. The sounds resonate into me. So I said all that to say, continue showing up for yourself. Continue doing what you're doing, because look at old Dr. Johnson here. Really appreciates your content. That's why I'm always telling people, continue to show up for yourself, because you don't know who and what people like and what people have their interest in. Who would have known? So Dr. Johnson, big healthcare professor, likes to hear sounds and therapies while he's going to sleep. Let's continue. Everybody, I want to bring up my guest. It's time. Dr. Lewis, I see you. Welcome on in. Oh, perfect. Good. No issues as we like. Dr.
Oh,
T,
am I? Can you see me? Hold
no,
on.
not yet, ma'am. We can't see you yet, but we can hear you.
Okay, let me see.
Okay. Okay, you see, Dr. T is still in the office.
I'm
Okay, and
still
I
in
know
the clinic.
you just clocked out at 6:15, right?
I know. Yes, yes, yes,
Question:
yes.
before we get into you just did a 40-hour work week, or you started off you're in the midst of your 40-hour work week?
I'm more than 40 hours in my work
Hey,
week.
hey,
I'm on like a 60-hour work week. So yes, I am above 40 hours, but it's my choice. I own two clinics, so I am above 30 hours. Yeah.
Dr. T,
Hi.
welcome to office hours with Dr. You got me stuttering, can't even speak right. Let me get right. Two clinics, the short stuff, you heard that. Okay, but
Right.
we gonna get into that. You heard that, but we gonna get into that, okay?
Yes, yes, yes.
Dr. T, welcome to Office Hours with Dr. J.
Thank
I
you.
I
Thank you for
appreciate
inviting.
I appreciate you being here. I appreciate what you are doing. I came into about two of your lives since we got connected. I came into about two
Yeah,
of your lives, and I said, "Hey, we got to get connected. I love what you're about." I did my homework on you. You know I do my
absolutely.
homework, so I did my homework on you. Okay, so
All right.
before we start, you know the drill. You know what I'm going to ask
I
you.
do. I
But
do.
I just want to let you know and let everybody else know the questions that I have for you based on your background and what you
Okay.
have worked within. I kind of tailor the questions for relating to clinical practice and cultural competence,
Okay.
communication and language barriers.
Okay.
Okay. And then also, I have it relating to health equity and access to care. Those are all topics that you've discussed over on your multiple platforms.
Hmm.
So I just wanted to make sure that healthcare is collaborative. We're bringing it all together.
Absolutely.
Before we jump into all of that, can you introduce yourselves, your brief background of who you are, what you do, educational and professional background, whatever titles you don't want to give us? This is social media, but you say you own your
Right.
own two clinics. So if you wanna drop your two clinic
Look.
name, you can drop your two clinic name. I beg.
Absolutely. Absolutely. Thank you so much. This is my first interview. Normally, I'm interviewing everybody else. So it's
Exactly.
interesting to be on the other side and none
Exactly.
other than you, because I've
Okay.
been in your live and I've kind of seen what you did. And I'm like, I'm comfortable. I like this.
Yes. Thank you for saying.
Um,
Thank you for saying that. Okay.
absolutely. Absolutely. I don't
Thank you
just
for
go
saying that.
anywhere. So,
Okay, thank you for saying that. And not to boast and brag, but like I tell people, there's so many people who I reach out to and they're kind of like,
mhm.
but once they see my lives and see my energy, it's like, okay, this man know what he doing.
Yeah,
It's not
absolutely.
no, it's not no funny
100%.
business. It's not no
No,
funny business. Let's
no,
believe it.
no.
Welcome on in. I'm sorry. This is all for you.
Absolutely. Oh,
Take it
no
away.
worries. As you know, I am Dr. T. So I am a physical therapist by profession. I've been a physical therapist for over 13 years. And beyond that, I am just more of a connector and a resource to
Mm-hmm.
everyone.
Mm-hmm.
I own two clinics. We do physical therapy, occupational, and speech therapy for adults and pediatrics here in Houston, Texas. The name of the clinic is called Rock Rehabilitation. And so we take all diagnoses, all sorts of um, different ages, population, and so forth. I come from a big hospital background
Mm-hmm.
where I wasn't given a seat at the table.
Okay.
And based on my history and based on the knowledge that I had, I felt like I could do this, but I wasn't given that opportunity. And so I said, you know what? Why do I need this? Let me just step out and see what happens. And I've had my brick and mortar for about 4.5 years now, but I've
Mm-hmm.
owned the business for about 8 years. So
Nice.
I am now transitioned into the Health Hub, which is really a hub of physical, mental, financial, public health, where we want to give the accurate information and knowledge to others. I was going out one day, and the person next to me was a plastic surgeon. And that plastic surgeon was turning up with me. And I just happened to be like, hey, what do you do?
Mm-hmm.
And he was like, oh, I'm a plastic surgeon. Da 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 da. And he was just speaking knowledge. And I was like, do people know this? And he was like, well, I don't really have a platform for it. Like, I mean, people that know me professionally know me about this, but others don't. And I said, bet. What I'm going to start doing is the people that you see out eating, going to brunch, going out in the club, they also are expertise in their own areas. And who best than to educate us about us, right? So I just started reaching out to my network, and my network is bigger than I thought my network was.
Right.
I started reaching out to my network and say, hey, I need you to talk about financial health. Hey, I know the county clerk for Harris County. I called her up and I said, hey, Tanisha, I need you to do a live with me. I called an OBGYN. I called a breast cancer oncologist. These are people that are just in my phone book. And then I'm like, I need you to share information that people don't know about that could help. And so I have been super privileged to be able to do so. I just woke up one morning, end of June, decided to do the Health Hub, and I've had 20 speakers since then. And it's been amazing. And I really hope to bring the same energy, to bring the
Mm-hmm.
same knowledge, to bring the same resource to TikTok. I was invited by My Blessing Has Arrived. She said, I love what you're doing on the other app. You need to come and do this here.
Right.
And so once she introduced me and kind of paved the way for me, it's been up since then. And then I came into your live. I don't even remember how I got into your live, but I got into your live and I was like, yo, he's like a male version of me. I
Mm-hmm.
was like, this is accurate information. He's bringing the right people to talk. He's not
Mm-hmm.
just speaking on things that he's not aware of, but he's
Hello.
actually bringing the people that are knowledgeable to talk about it. I was like, bet this is something that's it's not even a competition. This is something we
Mm-hmm.
got to do because there's not even enough of us. So I'm like, I need it to be more. So I truly appreciate this opportunity. I thank you all for being here. Those that I've shared it out to that has come in, thank you so much for honoring this. As I'm growing and I'm learning on this app, I think I'm in the right rooms and I think I'm in with the right people. So
Right.
I don't take this for granted. Thank you so much.
Right. And they're in the
Sorry,
chat.
long intro.
That's all right. I like that. They're saying in the chat it was meant to be. It definitely was. And
Yes,
Miss Renita said collaboration is key. I just want to also throw out there. I'm not a boastful and braggy person. That's not
you're
me.
right.
You
Right.
can't be in healthcare. You can't be like that. You have to
Nope.
know how to work with
Together.
within interdisciplinary. Okay.
Mm-hmm.
And so oftentimes that ego will
Yep.
and
Yep.
the patient is left
Mm-hmm.
stuck.
Yes. Yes.
So
Yes.
it's
Yes.
important to make sure that we are taking our pride aside taking out our ego and working collaboratively together. Okay, so I like how
Absolutely.
you mentioned that it's never no competition with me.
No,
All you guys out here with Dr. Johnson is never no competition.
yeah,
With Dr. T is never no competition.
none.
Healthcare is collaborative. I'm doing this. I'm a visual
Absolutely.
person. I'm a visual learner. So when I'm doing my
Me
teaching,
too.
I like to,
Me too. I'll be
healthcare
like,
is collaboration. Okay. I want to jump right into clinical practice and cultural competence. You have
yes.
so much information. You have so much experience within this. Okay. First
Hmm.
question, ma'am. How do you adapt your evaluation and treatment approaches to align with a patient's cultural beliefs, values, or norms?
So that's a good question,
Hmm.
because I do get different patients from various cultures,
Right.
right?
Right.
And I think the best thing that I have done that I do is I listen.
Right.
You know, most times when you go into your healthcare professional, they're in there, they're like, da, 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 I want to do this, we're gonna do this, we're gonna da, whatever, da, 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 da," and then they're out. Like it's the other way for me. A lot of my sessions are one-on-one, unlike most therapy clinics where there's 5 to 1. We are one-to-one because I want to hear you. I want to know if one, the jokes I'm making with you is appropriate. Two, if I'm making sure that whatever I am doing resides with you,
Hmm.
right? I have so many different people from different backgrounds. What works for one background may not work for the other. I have
Exactly.
taken it upon myself to even take cultural adaptation classes online to
Hello.
see that, how can I educate myself? Because they look at me and some people think I'm a tech. Some people will ask me, "Oh, did you go to school? Do you have a degree?" I get asked that. Well, I used to get asked that all the time, right? And so I had to find a way to say, okay, is it me? Let me educate myself so that the way I come across will be professional. The way I come across will be culturally sensitive. If there's a culture, like I had a huge population of Middle Eastern,
Hmm.
right? And I had to go in and look up that culture and see what is appropriate, what is not appropriate. But the best thing that I do, that I teach my staff to do, my clinical team, is you have to listen. If they're talking slang, does not mean you match their energy. No, because you don't understand it. I'm Nigerian. I can meet another Nigerian and we understand ourselves, but a non-Nigerian coming in wanting to act Nigerian might be offensive to me.
Exactly.
So staying professional at all means listening to the patient. I'm gonna say listening 1,000 times because that's something that we typically don't want to do is listen to the patient.
Right.
And as we relate to them, patients will tell you, "Hey, I don't like when so and so did this," or "I don't like this being done." If you listen to them, they will tell you what they like and do not like. So my biggest part of practice is educating myself. There are
Right.
courses out there that I can do to make sure that I am not just representing me, I am representing physical therapists, I'm representing Black women, I'm representing entrepreneurs, I'm representing so many different groups. So I need to make sure that how I am coming across is sensitive,
Hmm.
is accurate, and is
Hmm.
professional at all times.
Right. I love that. Thank you for sharing that. Everybody in the chat, welcome
Hmm.
on into Office Hours with Dr. Johnson. Everybody that just joined in. PD, I see you. J Money, I see you. Dr. Henry, I see you. Welcome on in. Today, Office Hours with Dr. Johnson is interviewing subject matter expert, physical therapist, Dr. T. Okay. Did I drop the subject matter expert stickers in the chat? Can I have one or two persons in the chat drop subject matter expert? And as you all know, thumbs up or praying hands is me that's acknowledging you guys in the chat. I don't want to interrupt my guest. Okay. Let's continue. Dr. T, can you share an example of a time when a cultural understanding significantly improved a patient's outcome? Okay, because we're always talking about, oh, being culturally competent. This is what it would do. This is what it would do. This is what it would do. Can you share a personal experience? I love to do that. Love to bring personal
Hmm.
experiences. Once again, can you share an example of a time when cultural understanding significantly improved a patient's outcome overall?
Oh, absolutely. Several times. There are times where um how do I want to be mindful of my words, right?
Right.
There are times where a non African American
Mm-hmm.
provider is treating an
Mm-hmm.
African American patient.
Mm-hmm.
And, in some areas, there is not that understanding of culture. So the
Right.
patient doesn't quite gel with the provider, and
Right.
it almost seems like there's a gap, right? And there's been several times where honestly I've walked in the session, they look at me, or let me go back. Let me give you one. Let me give you one specific one. We treat a lot of patients with autism.
Mm-hmm.
And there are times where, there's the autism, but there's also the toddler who has autism.
Mm-hmm.
They're different. There was a kid that I shared with an occupational therapist, and in the OT's session, he's always throwing a tantrum. I
Mm-hmm.
mean, he's rolling on the floor. He
Mm-hmm.
is just not getting it, and she's just kind of like, we're gonna call him Johnny, HIPAA because of HIPAA,
Mm-hmm. Mm-hmm.
and John, she's like, oh, Johnny. Johnny, I need you to sit, Johnny. Please
Mm-hmm.
sit, Johnny. And one day, and I'm hearing that he's banging the wall, he's throwing things. One day I said, you know what? Today I have time and I have
Okay.
energy.
Okay.
I walked in there and I said, Johnny, sit up, sit down,
Mm-hmm.
and let's focus.
Right.
When I tell you he got up, he sat down, he focused. I said, the OT looked at me and said, Dr. T, how did you do that? I said, I treated him the same way that I treat everyone.
Right.
You're here. This is not a game.
It's
I
not.
am not wasting your parents' time, the state's resources, your parents' money to come in here for me to be like, hi, Johnny, how are you? Thank you so much for coming. No, you're here to work. So we're going to get to work. And after that, what did I do? I pulled the OT aside and I said, if this patient, I used the diagnosis. I didn't use the race. I
Mm-hmm.
said, if this patient did not have autism, how would you treat this patient? She
Mm.
was like, oh, I would be more stern. Meanwhile, I'm not talking about the diagnosis. In my mind, I'm talking about the race, right?
Right.
But I'm mindful of how I break that apart. She's like, oh, I would just tell him he needs to sit down. We need to focus. I said, so why didn't you do that with him?
Right.
She was like, well, I said, absolutely not. How you would treat one patient, you have to treat everyone. Now, there are varieties, right? Because every
Mm-hmm.
patient presents differently. So I'm
Right.
not saying what works for one patient works for the others, but you have
Correct.
your foundation. Your
Exactly.
foundation needs to be consistent. Right. And
Mm-hmm.
so she was like, well, I would be more stern. I would tell him to sit down. He needs to focus. He needs to, then I said, then that's what you need to do.
Right.
I said, it
Right.
shouldn't take me coming in. He saw me, and with two sentences, he got it together.
Right.
And I know it was a cultural thing because he was just kind of like, oh, that could have been my mama. Let me go.
Mm-hmm.
But we need to treat that patient the same,
Right.
right? So
Right.
I've had several instances where I've had to step into sessions,
Mm-hmm.
and I don't mean to say show my blackness
Okay.
in order for them to say that, oh, this patient does get better. Because if I didn't step in, my fear is that she could have said, you know what, he's not appropriate anymore. We can just discharge.
Right.
Whereas he's gone off, I actually saw him today. He's gone off and he's in school full time.
Mm-hmm.
Whereas before there was a stigma on him that he probably wouldn't have gone to school. He doesn't want to listen. He doesn't
Right.
want to follow directions. No, he does.
Mm-hmm. He does.
Absolutely, he does.
And he
So
can.
there's,
And
and
he
he can,
can. Okay.
and he can.
Mm-hmm.
So it is up to us to kind of step in. So I have had to in several, and I don't mind it because in my mind, I'm advocating for them. I'm advocating for young Black boys. I'm advocating for young Black women, girls, and adults, our geriatric population. I
Okay.
am absolutely advocating for them. Every time I step in a room, I let them know that you can continue to do that.
Right.
So I have several stories
I love that.
um, that I just have to be mindful and use wisdom and not
Exactly.
come out and say, "Oh, it's a race thing." I have to use wisdom in bringing the attention out that it's a cultural thing, and we
Hello.
absolutely need to be respectful of that.
I love that. Thank you for sharing that. And in the chat, they're
Yes,
telling you thank you
a-
for handling how you handled it, and thank you for being an advocate. Okay, because at the end of the
absolutely.
day, no matter what sector of
Mhm.
healthcare you're in, there's still a duty to provide quality care, and
Absolutely,
there's still a duty to advocate for all patients. Okay,
absolutely.
I want to stay on this topic just for one more time,
Hmm.
one more moment. Okay, what does or how important is cultural competency in healthcare overall. I'm always screaming about it. I want you to scream about it to them.
Y'all, it's super important. I am where I am today because of the lack of cultural competency in the biggest hospital. I worked at
Hey.
number two level of nation. Wait, number two in the nation level of hospitals,
Mm-hmm.
and there was cultural competency. There
Mm-hmm.
was. I did the training there, but
Mm-hmm.
I did not go through it. I did not excel that way. I did not progress within cultural competency. So it is so, so important to not only do the trainings, to not only say, oh, we check it off, we do our annual competency, HIPAA,
Right.
safety. It's beyond that. It is actually seeing ourselves in there teaching it and being
Mm-hmm.
an example, right? I
Mm-hmm.
wanted to be, I played so many roles. I played so many admin role when I wasn't even getting reimbursed for it because I wanted people to learn about cultural competency. For
Hello.
I was one of the highest level spinal cord injury therapists there. And I was not getting paid on that level. However, new therapists that came on, I spoke to them about cultural competency. I
Mm.
spoke to them about safety. I spoke to them about resources. I spoke to them about equality, equity. All of those things play is so, so important. And it's easy to get lost when you're in a big institution. They do the little checkoffs and then they think that's it. But it's up to us to push for it. When I see some, I say something. When I see that, hey, something ain't right about this, I don't just say, oh, well, no, no, no. Now I'm mindful how I speak up. I'm
Right.
one of those where I can speak their language
Right.
and I'm, hey, isn't it weird that the like I know how to speak your language. I know how to get my point across because it is so important and it is lacking and it's sad and it's really heartbreaking because we deserve so
Mhm.
much more,
We do.
right? And so I think it's something that you see something, say something. If
Right.
there's a part that you can play, play that part. I
Right.
did what I could because I wanted to impact. I was like, you know what? I could get paid for it, but the impact of what it would have on my patients, long way. And so again, that's another part of me advocating for them. So if you have an opportunity to be in administration, or if you have an opportunity to take a lead or something wherever you work, please put cultural competency in whatever format you want it to be. Because I'm telling you, you will excel and people will come back and say thank you.
Okay. Thank you for sharing that. And look, my blessing
Hmm.
said, yes, when in Rome, act like the Romans, speak their language. Exactly. And Steph Shika said, see something, say something. Yes.
Absolutely.
You always, when you see something, you always, and we also have to remove the fact of, oh, we're snitching
No.
or we're selling out. Remove that. Remove that. This is patient's life here. This is
Mm-hmm.
quality of care here. So that whole snitching and selling out, not in healthcare. Thank you so much
No.
for your support. Not in
No.
healthcare.
No.
Okay. Let's continue. I want to get into the
Hmm.
communication and language barriers. Okay. Because you said
Yes,
that you do serve a diverse patient population. Okay. And
absolutely.
Texas is diverse too. They may not want to talk about it. Texas is
But
diverse too.
yep.
How do you approach patient education when working with individuals who speak limited English or use different communication styles? You mentioned that earlier on too. You see how I'm tying it in together?
Right, right,
Re-
right,
I'll
right.
repeat the question one more time for those in the back. How do you approach patient education when working with individuals who speak limited English or use different communication styles?
Thank you for that. That's a very, very good question. This is where my resource comes in.
Hello.
If a patient has insurance, if they, especially even if it's not state funded, under their insurance benefits, they are entitled to a translator. No one can come in and treat you without you understanding your treatment or even being told your treatment. Almost like you cannot go and get a document notarized and the notary cannot explain to you what you're signing. You cannot sign a document without understanding. You cannot get healthcare without a translator.
Hello. Hello.
You have to, I tell all my patients, once I hear that if I cannot fully educate you, call the number in the back of your card. Where's your card? Call the
Right.
number in the back of your card. It is a now the difference is it is a patient benefit. It is not a clinic or hospital benefit. So the hospital and clinic cannot call on your behalf. This is part of the patient's responsibility. You call and say, "Hey, I have a clinic appointment on Thursday at 10:45 and I need a translator." You are entitled to have a translator. So that's one thing I tell my patients. You have to understand what I'm telling you. This is your health. This is your life. And I want to treat people the way I would want somebody to treat my loved one. I don't want my loved one going to a therapy session and they can't understand, stand up, sit down, put your feet up, do this, do that. That's, first of all, that's cruel. And I'm not going to judge you because you don't understand English. What I'm going to do is find resources. So that's one thing I do. I go to the insurance and say, I need a translator for this patient. They need to understand their plan of care. They need to understand their benefits. Same thing with transportation if they can't get in. Another thing that I have done in the past is they're medical students or they're students in healthcare professions that are maybe sitting for their boards that are very diverse and would love to take on this translating. So I have done that. I have gone on Facebook, I've gone on my social media and said,
Mm-hmm.
hey, this clinic is looking for someone that's willing to translate. Are you a healthcare provider or a professional that's able to do so? We have those. There are also not AI, but there's some translating devices that we've also tried on where it's almost like they're speaking to a computer, but
Mm-hmm.
it's someone on the other end
Yeah.
and they're calling back and they were able to translate that way.
Right.
I've also used Google Translator,
Mm-hmm.
right? Because there's times where um culturally wise, let's say it's a woman and she doesn't want her husband to hear that she's having pelvic pain during
Mm-hmm.
sex, right?
Mm-hmm.
And he's the one that speaks English and he's the one translating. So in order for me to and maybe I didn't know that this barrier was going to get this deep until
Mm-hmm.
I'm in the session.
Right.
Oh, I excuse him. I pull out my Google Translator. I open up where she can actually speak into it and it translates and we're able to communicate that way. There's
Right.
so many ways to communicate for the safety and in order to give good care for a
Right.
patient that does not speak maybe 100% English or a
Right.
good amount of English. You can still give good care. There's so many options. Last, if you can't do anything, Google Translator will be your best bet.
Thank you for sharing that, and thank you for
Hmm.
sharing what you have your experience in ensuring that the communication is key. The
Absolutely.
reason why I wanted to ask that is because there's oftentimes we're not bashing no other healthcare professional,
Right.
but they can at times they can be dismissive. Let's keep it a buck.
Yeah.
Okay,
Yeah. Yeah.
they can
Yeah.
be very dismissive
Yeah.
when there's a lack of communication. Okay,
Hmm.
so I just wanted
Hmm.
to make sure that I threw that question in to show that hey, not all healthcare professionals are like that.
No,
Okay,
you can still give good care. You can
right.
still think about it, you guys. Think about your family. Like every time I see a patient, every time I greet a patient, someone told me that I'm very close to my patient.
Mm-hmm.
They would say, oh, aren't you scared? Or even if, let's talk about communication. Let's say they just speak softly. They're not a loudspeaker. I get close to them.
Right.
What is it that, like, I feel like I have to hear you. I have to understand you. I got to get close. First of all, I'm a physical therapist. I got to
Mm-hmm.
get close to you, right?
Mm-hmm. Mm-hmm.
But at the same time, I think about if it were me or my loved one that is in this position, how would I want somebody to treat them?
Right.
I believe in what goes around
Come.
comes around. So
Right.
I'm going to treat you with love. I'm going to use all my resources. All of that is billable. That's another thing because most places will say, "Oh, but you spend so much time with that. We can't bill." Yes, you can. That's patient education.
Hello.
Yes, you absolutely can. So even as an entrepreneur, let me put my clinical hat down. Let me
Right.
put my entrepreneur hat on. My provider comes to me and says, "Oh, Dr. T, I spend half my time on Google Drive." hey, you were educated. You were
Mm-hmm.
making sure that they understood what it is that they're doing. That document that. That is part of it. That's also a way to advocate for them to get those benefits and to keep benefits. If we're using the benefits, their insurance is going to say, oh, they need this. We're going to keep them, we're going to keep this with them. So you have to continuously put yourself in other people's shoes. That's what I do.
Right.
In all that I do, that's what I do. And I can't I can't do it any other way. Sorry, that was long-winded.
Right. No, it's all right. Now,
I got passionate for a second.
I was about to say that too. It's not long-winded. It's passion. Okay, and that's why you're up
Right.
here, subject matter expert. Can I have a couple people in the chat drop subject matter expert? Sefiko, I see you dropping my cultural competency sticker, or no, cultural diversity sticker. But can I have somebody drop subject matter expert in the chat for me, please? Let's continue. We're gonna wrap up this section of communication and language barriers.
Yeah.
I just want you to briefly share why is it important to address language barriers in healthcare overall?
Mm,
Why is it important? What can happen?
safety. When
Okay.
I think about that, you guys let me break it down. You can easily say, oh, PT ain't nothing about PT. What I need language. Guess what? If your blood pressure is not under control,
Mm-hmm.
you go home, you can stroke out right there and there.
Right.
If I don't educate you that your diastolic is too high, and every
Right.
time you come to therapy, it's over 100, and that's not therapeutic, and you go home and then you wake up in the middle of the night and you feel like that is safety. We are
Right.
messing with our lives. You gotta be able to communicate with your patients. Sorry,
Yeah.
I'm gonna bring I'm gonna bring my voice
I know
down.
you are. Yeah, I know.
I'm
Let
gonna
me
bring
lean
my
in.
voice down,
Let me lean
right?
in.
Okay, because so many things have been missed, y'all, due to lack of communication. So many diagnoses because the patient can't truly communicate all the symptoms. They can't say, oh, I felt my left arm tingling 3 weeks ago. They don't know how they're not given that opportunity to
Right.
really break down their symptoms. Therefore, they feel like, oh, arm hurts. They'll just put hand pain or something, not knowing that it's more than that. It's actually chest pain,
Hello.
right? What could
Hello.
that lead to? That could lead to a silent killer, which is, or sorry, I can't say that on here,
Mm-hmm.
but
Mm-hmm.
that can lead into heart attacks, right? You'll have your strokes where that's something that does not give you a warning. You don't necessarily have an aura. Safety is important. And so many little things, if communicated appropriately in a timely manner, clearly, then I feel like a lot of lives will be saved. I feel
Hello.
like a lot of diseases, a lot of disorders, a lot of issues, uncontrolled medical issues will actually be controlled because they're able to share.
Right.
If I
Right.
cannot share what's really going on with me, if I can tell you that I've been constipated or I'm not urinating completely, I feel like my bladder is still not empty. I don't know what's going on with my kidneys. They may not know it's kidneys, but they're trying to explain. Patients don't know this medical terminology, right?
They don't.
So they don't know that, oh, I have a decreased output, or that they don't know all of that. They just know I don't think I'm peeing all the way.
Hello.
They may be like, I get headaches. And when I get these headaches, I don't check my blood pressure. Should I check my blood pressure? Like, those are the things that I feel we absolutely need communication on so that we can hear the patient. Remember, I started with we got to listen.
Right.
We can't listen if we don't understand communication. So we have to be able to communicate with our patients, with our loved ones.
Mm-hmm.
This isn't just healthcare professionals. This is also your loved ones. When they're telling you things that are off, you're like, oh, this something ain't right about this. When you feel like it ain't right, it's probably not right. But the big to get come back to your point is safety. It comes down to early detection of anything, whether it be uncontrolled diabetes, whether it be uncontrolled hypertension, whether it be cholesterol, whatever the case may be. We
Mm-hmm.
need to be able to communicate our signs and symptoms in order for us to get the appropriate care that we need.
Right. Right. I love that. Okay.
I'm gonna calm it down, y'all. Yeah,
No, you don't have
people have
to.
seen
Yo,
people have seen me like dancing and having a good time, but when I'm here to educate. That's what I'm here to do. I'm not here. I'm not playing with y'all's lives. I'm not playing with the lives of your loved ones. I'm not playing with my life. I need us to be educated so that they stop messing with us.
Okay. Okay. Once again, subject matter expert. That's why she's here. Subject matter expert.
Okay.
That's why she is here. Okay. I want to wrap up
Mhm.
the communication language barriers. For those of you just joining on in, we have discussed communication and language barriers. We've discussed clinical practice and cultural competence. Okay. Now we're going to get into health equity and access to care. That's
Ooh,
big. That's important. Health equity and access to care. And my setup is different today. I'm on the floor. I'm sitting down. I want to get comfortable. I want to make sure that it's different today. I'm getting comfortable. The short stuff, critical information, therapy me,
right.
please, huge, exactly.
Yeah.
Cephalcore,
Yeah.
this is great. Patient advocacy is important. It definitely is. And I
It
appreciate all you
is.
guys for being here. And quick commercial break. I appreciate all, I didn't even realize the live goal. I appreciate all of you guys with the live goal. I appreciate, you can't even set no goal right now. Dr. T,
Yes.
health equity and access to care. Before we continue, you good? We good?
Oh, me?
Perfect.
I'm good.
Okay,
We're good.
perfect. Health equity and access to care. Okay, that's what we're going to discuss next. Okay, what barriers to care do you see most frequently in underserved communities, and how do you help your patients navigate them?
Oh, it's knowledge. I've
Mm,
even this past week, you guys, with my patients, I had a patient tell me that I thank God for you because
mm-hmm.
you've educated me more than others. It is lack of knowledge. First of all, I do want to say people are scared.
Yep.
People don't want to say something, and when they feel something isn't right, they
Mm-hmm.
don't want to say anything. And when they do go see their healthcare providers, they're not saying the whole story. Whether they feel that they're not going to be heard, whether they feel that they're not going to be taken seriously, whatever the case may be, um, I just feel that there's that gap in the knowledge. And
Right.
so one of the ways that I help with my patients is I've actually joined my patient in their PCP, their primary care physician appointment.
Mm-hmm.
I've said, hey, call your PCP while you're here in PT. Let me
Mm-hmm.
tell them what you told me. I'm an advocate for you. Let me
Right.
tell them what you told me because you seem to forget when you
Right.
go over there.
Right.
Another way I do it is I have them do a log everything that is happening in their health. I have them write it down. You
I like
gotta
that.
write out what's going on.
You have to.
Today I had a headache at 4 o'clock, and then you start noticing every day at 4 o'clock you have a headache, so
Mm-hmm.
that when you do go to your doctors, you're able to. I tell them, bring out that notebook and start explaining what's going on. Start
Right.
telling them what's going on. You
Right.
can't keep quiet and expect for them to come and help you.
Right.
Unfortunately, we have to speak up.
We do.
Unfortunately, and so I do encourage my patients. You got to fight for yourself. Nobody's fighting for you but you. I'm trying to fight for you, but I
Hello.
can only go to a certain level. You
Hello.
have to step up. You have to be able to advocate for yourself. So I do teach that advocacy. What do I do first? I start, like I said earlier, call your PCP with me here. You see me in the background doing this.
Right.
Like,
Right.
I'm so animated, I would write on a piece of paper to give them that confidence that they need, so that whenever they do call on their own, they feel like they are more, they have that confidence, right? They're
Right.
not feeling so defeated.
Mm-hmm.
We in a lot of rural areas, the healthcare is not the same,
It's not.
right? The access is not the same.
It's not.
There's transportation issues when there's people that need transportation and they're being told, oh, if you don't get here or if you can't get here, we're going to cancel your appointment. There are ways to help them. Again, your insurance has that benefit
It
so that you
does.
can go ahead and get transportation to your healthcare. So there's so many barriers that I've noticed. Speaking of lack of confidence, fear of them actually wanting to speak, transportation, them not even understanding their bodies, so many things, cultural, even religion, where they're like, oh, I'm gonna pray it away. I don't want to say it out loud because when I say it out loud, that means the devil. No, and that's a no. I- and that's a no. I need you to
No, no, no,
speak it
no, no,
up
no,
and put the
no.
devil to
Hold.
shame.
Right, right. I want you to bring that up one more time
Ooh,
too. I'm a Christian too, so what I'm about to say
yes,
is nothing. You a Christian too. You Nigerian,
absolutely.
okay?
I
And
am.
we are both saved and sanctified, okay? The
Hallelujah.
blood still works.
It still
The
works.
blood, okay? It
Yes.
still works, okay? But I want
Yes.
to address now that I have another healthcare professional on here with me. I want to
Hmm.
address the it's I don't want to call it a phrase.
Right.
I'm gonna pray it away.
Oh, child.
I'm going to
Oh,
pray it away. And guess what?
child.
I'm not saying you can't have faith. As us
Of
Christians and
course.
as religion folks, we have to have faith. Okay, they
Got
drop in the chat.
to.
The blood still works.
The
We have
blood
to have
still
faith.
works.
Okay,
Yep.
but guess what? With me coming on here and advocating, I want to let people know you could have faith and you can pray it away. But let's get that clinical help as well too.
You have to.
Okay.
You have to. Because let me tell you, I've had patients coming that had spinal cord injury,
Mm-hmm.
maybe T level down, they're paralyzed.
Mm-hmm.
And they're like, oh, I don't want PT. The Lord, somebody saw that I'm gonna walk again. Disputing that. I'll be the first one to pray with you and be like, Lord, use me. And that's my prayer.
Right.
Use me
Use
to
me.
help these people. So it's not even me. So at the end of the day, it's still the Lord. However, you have to do the work. You cannot sit down and be like, oh Lord, the Lord gonna do it. No, no, ma'am, the Lord not gonna check your blood pressure.
Hello.
The Lord is not checking your glucose level. The Lord
Hello.
is not telling you to put that cake in your mouth knowing that you pre-diabetic. The Lord is not
Hello.
telling you that. And if you're really listening to the Lord, he said your body is a temple. There's so many things that goes into it. So let's not pick and choose. But I have those. Funny enough, when I was at the hospital, I would treat all clergy. I said, "Oh, I think the Lord tried to tell me something." He tried to
Mm-hmm.
say I need to be covered by the blood of Jesus. I've
Mm-hmm.
treated one of the biggest bishops in
Mm-hmm.
Houston. I've treated, and at the end of the day, what did they say? I know I have my faith, but I got to put the work in.
Mm.
You have to do it. The Lord is still doing, no matter what it is still God. Every good things come from the Lord. Every good thing. So when you know that every good thing comes from Him, but He uses vessels. So your PT is a vessel, your mental health provider is a vessel, your
Hello.
PCP is a vessel, your
Hello.
neurologist is your vessel.
Hello.
God has put in so many vessels in place to lead you because you cannot do it by yourself. And
Right.
honestly, a lot of us need that vessel because we don't even hear God directly. Ha! Throw me away. Throw me away. Y'all shouldn't have given me this platform. Throw me away. Because I'm telling you, you cannot say, oh, I'm going through a mental health crisis. And the Lord, no, God has put the people in place so that they can help you, so that they can guide you. So, I used to hear it all the time. Oh, the Lord said, I'm going to walk again. I'm not disputing that. And
Not
I pray
disputing
that
that.
you do. And I'm going to
Right.
help you.
Right.
However, you got to do your part. You cannot just sit back and just think that the Lord is going to do everything without you doing anything.
Right. Right.
So that is so critical in our culture that I think it has hindered a lot of us,
Right.
to be honest. It has stopped a lot of progression because we feel that, doing this is us going against the word, but it's not. It is not. When I treat, it's not me treating. The
Mhm.
knowledge and the understanding and the wisdom that I have is not me. I ask God to bless my hands, to bless the
Okay.
words that I speak, how to encourage people. So
Okay.
please trust that especially if you're a Christian or whatever religion that you're in, make sure that you kind of coincide with that person so you know that it's from God. If it's not, all of this is not from us. Dr. Johnson being here and being a resource, he's doing the Lord's work.
Amen. Hello.
God is using him as a vessel. He's bringing people to help you. So it's something that I do fight. I still fight almost every week in my clinic and people know me. I pray. That's why I own my own clinic, because I'm a praise the Lord,
Mm-hmm.
right? And they know me for that. At the same time, you got to do the work, and we got to
Right.
do the work together. So I can let me not preach, because
Right.
you're not gonna invite me back.
Right. You always
They're gonna
welcome
be
back.
like, don't let Dr. T come back.
The chat was moving fast. Hold on. Therapy Me Please said religion is a huge factor when it comes to treatment. It really is. It really
Hmm.
is. So, all in all, I know you guys, all y'all on here, I know Psalms 23 is strong. I know Psalms 23 is
He's my
strong.
shepherd.
Okay, I know Psalms 23 is strong, but please reach out to your mental health provider.
Please,
Please reach out to your PCP.
please,
Please advocate for yourself
please.
every time you go
Yes,
do a checkup for yourself. Please don't be
yes.
afraid that, hey, I'm here for one thing, but I'm
Mm,
experiencing this, but I'm gonna ask the Lord to just help me get through
mm,
this. Okay? Have faith. I'm not
mm-hmm.
saying for you not to have faith, and I'm not saying for you guys not to pray, but please speak up for yourself. Okay?
Absolutely.
And please don't be afraid of medication. Medication is not
No,
there to harm us. It's
no.
science. It is science. Medication is not there.
Hmm.
Not pushing. I'm not pushing it on y'all, but I'm just saying that there's that route too. Because
Yeah,
I've also held a panel where somebody was like, they receive patients who were like, I don't want medication and therapy. I'm just purried
yeah,
away.
yeah,
That's good. That's great. You can, but let's get that clinical help.
yeah. Hmm.
Okay,
Absolutely.
we're gonna switch gears because we we
Yeah.
we we we
Switch.
we got all over the place a little bit. Okay,
I know,
let's
sorry.
let's yeah, but guess what? It's needed. Okay,
Yeah.
it is definitely needed. Let's bring it back into health equity and access to care. That's what we're
Yes.
talking about, and we over here hooting and
Yeah.
hollering about the blood still works. We're supposed to be talking about health equity and access to care, and we over here hooting and hollering about the blood still works and Psalms 23.
Right.
Dr. T, how does socioeconomic status impact compliance, attendance, or long term outcomes in your experience with your two clinics and even your experience working at that large healthcare facility?
Repeat that one more
Socioeconomic
time.
status,
Someone was calling me. Sorry.
no problem. How does socioeconomic status impact compliance,
Oh, yeah.
attendance, or long term
Oh, yeah.
outcomes as it relates to your experience at your clinics or previously at your large healthcare facility?
It plays a big role. It
Mm-hmm.
plays it is socioeconomic. They have their own barriers, right? They have their own barriers in the sense that one, I don't even think they understand the importance of compliance.
Hello.
You know,
Hello.
sometimes they do something one time, two times, and it ain't working. I don't want it.
Mm,
But you got to give it time. You have to invest in it, right? So that's one. Another part of it is because they're not knowledgeable of how this can truly help them in so many areas about it. They don't believe in it. Due to the socioeconomic status. I have to do so much education.
hello.
I have to explain to some people why they need to take their blood pressure medicine every time they come to therapy. And they come to therapy 2 times a week.
Right.
So if I'm explaining it every single time, what's going on when you're not here? Right? So it's almost like because they don't have the knowledge, they don't have the understanding, they don't believe in compliance, they don't feel like, oh, maybe this is something that they need. I'm just here because my doctor said I need to be here. They don't understand how it can truly affect them. I feel like compliance is low. But that's also because we hold some knowledge from them. Some people
We
don't
do.
say the whole thing. Some PCPs, I hear some neurologists tell patients with Parkinson's like, "Oh, don't go get resources because you it's not going to work anyway. You're going to progress quickly and you're going to be unalive and stuff like that." And we're not putting the right people
Right.
in those areas to truly educate so that compliance can work. So in other words, what I'm saying is they're not those areas are not staffed well,
They're not.
therefore they don't get the right education.
Right.
They don't have all the info, they don't have the right education, therefore they don't believe in what even their doctor is prescribing, therefore compliance is low, healthcare declines, then it becomes an issue. They have increased comorbidities, whether it's blood pressure, whether it's kidney, whether it's dialysis, whatever the case may be, and then it goes south from there. So it brings us all the way back to if there's something we can do, is be in those areas. I volunteer. I do nonprofit work because I don't want, I get patients from rural areas. So what do I try to do? I try to go into those rural areas and be like, what y'all know about PT? What y'all know about talking to your doctors? What do y'all know about this? Because once they understand what it is, compliance is better. Once they
Right.
have that buy-in, I do a lot. Oh, I do a lot of education to just get them to understand their doctor is not against them.
Oh
Their
my
PT is not against
gosh.
them. Their mental health provider is not against them. We are working for you. But because we're not appropriately staffed in those areas, they don't get it.
Right.
And that's why they need to come out more and be more compliant. If they come and see me more, I'm able to drill it more in their head, they'll become compliant. And then you have your, transportation issues.
Mm-hmm.
Oh, I don't have nobody to be with me. Everybody
Mm-hmm.
going to work. There's so much. They don't have caregivers, so I help them with caregiver services. I'm
Mm-hmm.
like, your little cousin, he lives with you. Can he be a caregiver? I'm going to link him up with a healthcare professional or a healthcare company and make him your caregiver. Now you have to come to your sessions. So I also kind of pull in some little resources and kind of help that way. But it goes a long way. Compliance is not there. They don't get it. There's so many
Oh,
barriers. So
right.
if there's a barrier, they cannot make their appointments. They don't believe in it. They don't understand it. They're just gonna do a little bit and then keep it moving.
Right.
So it's tough.
Right. The short stuff in the chat said it's called holistic healthcare practice. Hello.
It
Hello.
is.
Hello.
Absolutely. Absolutely.
Therapy me, please. I see you in the chat too. I see you, therapy. Let's believe I see you like in the live. I appreciate you.
Yes.
This was a great conversation. I knew it was gonna be.
Absolutely.
I knew it was gonna turn out like this because when I found out about you and when I saw your work and just went to your page and went to your lives, I was able to formulate that you do more than physical therapy.
Oh yeah.
I want to repeat that again. You do more than physical therapy. And I realize that, I
Yes.
acknowledge that. And that's why you're here
Thank you.
today. That's why you're
Thank
here.
you.
So let's continue. I just wanted to make sure I said that before I forget. Okay.
I appreciate it. Thank you.
We might get a little bit controversial, but
Ooh,
what can healthcare systems do to reduce the disparities in physical therapy access? Not just at, okay, I know there's healthcare access overall, but I want you to
yeah.
hone in on your niche. I'll repeat the question
Yeah.
for the people then, okay? What can healthcare systems do to reduce disparities in physical therapy access? Mm,
Oh,
she
it's
said policy changes.
yes. Let
Hello.
me tell you, people don't understand physical therapy until
Hello.
they're out in a car accident, they had a stroke, their child or their loved one has autism. There's so much that is happening. And
Right.
until, like she said, policy changes from the top.
From the
I
top.
just had this
Right. Right.
conversation with someone on Saturday. I said, and I don't know if I can say it, but I'm gonna say it.
Mm-hmm.
Until it happens to a
Mm-hmm.
family member or to the person at the top, it's not gonna work. I'll give you two examples.
Hello.
Governor of Texas is in a wheelchair. I worked at the hospital
Mm-hmm.
where he got therapy. Now, I came after, so I wasn't one of his. I came after. If it wasn't for PT,
Hmm.
if it wasn't for physical therapy, occupational therapy, and speech therapy, we would not be where we are. The senator, I believe, senator of Oklahoma,
Mm-hmm.
as I saw her in getting treatment here and there, but she's able to run for a senate because of PT. But people don't believe in it. The insurance pays
Don't.
so minimal. It is embarrassing.
Hmm.
It is embarrassing what is reimbursed. Why? Because it's almost like these PT. Oh, when you have a stroke and you can't move your whole left side, but you got to get back to work because you're the primary custodian and you have little kids. Oh, now I need PT. Or yes, we're not even going to talk about limited sessions.
Mm.
I am not neurological board certified, but I have treated neurological disorders for at least 6, 7 years
Mm-hmm.
minimum because
Mm-hmm.
I'm 13 years in. I once got an insurance to tell me that I should be able to cure, fix my patient with Parkinson's disease in 4 visits.
Hey.
I have never lost my cool like I did that day.
Mm-hmm.
I called up and I was like, escalate me to the top.
Right.
because I need somebody on this level to tell me how that would get done. Policy changes, advocate. We just had in November, we just had a voting session.
Hmm.
And in that, on that ballot, one of it was patients orders getting care. AirPod don't drop.
Hmm.
I'm too hot. They on the ballot was one of the changes for neurological disorders. If you or your loved ones has dementia or Parkinson's, getting care later on. Do you know how much work I had to do for people to get out to vote?
Hey, y'all
I
are.
was like, you guys are not looking at your future. You're looking
They're
at
not.
how it affects. That's the health hub is health hub. Public health falls under that. And I'm part
It
of the
does.
greatest sorority, Delta Sigma Theta
Okay.
Incorporated, and we are huge
Okay.
on voting rights. So I make sure people go out and vote. That's part of it. Voting, knowing what's on the ballot, knowing what can affect you or your loved ones. It has
Right.
to come from policy change. Other than that, it doesn't work.
Right.
It
Right.
doesn't work. So policy change is it is it. We have to vote. We have to be knowledgeable of who we are putting in office.
Hmm.
We have to look at what they stand for. We have to look at ourselves down the line and not just today. Today you're healthy, you're whole, you're moving. What about tomorrow? What about your parents? What about all of that? All that
Yeah.
plays a big role. So that's where I think it changes is with the policies.
I love that. Thank you for sharing that. And let me just quickly just go through the chat because you
Yes.
guys, I have not been ignoring you guys in the chat. It's just that when we get to going, we get to going. Okay.
Sorry, we
I just
get
want to make sure
going.
I didn't miss anybody. Therapy Me said the main barrier is how healthcare is viewed. It really is.
Yeah.
It really is. She also said moving patients every 10 minutes like a factory. Moving
Hmm.
patients every 10 minutes like a factory.
Yes.
Okay. Let's continue. I appreciate you guys engaging in the chat. We got to continue because
Yes. Thank you.
we're gonna wrap this up soon. Okay. Um, Dr. T,
Yeah.
professional development and self reflection type
Mm.
question. Okay. What advice would you give to new therapists who want to build strong
Mm.
cultural relationships with their patients? We're gonna wrap that up, and then we're gonna take it away for us.
Everyone is human. I
Mm-hmm.
tell I just onboarded two new clinicians
Mm-hmm.
and two of them are new grads.
Mm-hmm.
And I said, you got to look at in PTOTSD, you treat impairments.
Right.
I'm not treating you. I'm treating your signs. I'm treating your symptoms. I'm treating
Right.
your impairments. You can't walk whether you're black, white, purple, green, blue. I'm treating the fact that you can't walk.
Right.
And so I tell them you have to look at the person as a whole. I also tell them culture is important.
Okay.
Because we are in Texas, there we are truly diverse. You
Mm-hmm.
have to be mindful of the different cultures. And the
Exactly.
cultures does not necessarily mean Nigerian, Jamaican, Asian. That's not just culture.
Right.
Some
Right.
people think that's culture. Even within Texas, there's culture,
Right.
right? The South Side, North Side, you have to be mindful on how you communicate with people.
Right.
So for me, I tell them when you're coming on into this new, now you're an adult, you're coming into this work life, you're coming into this workforce, you have to look beyond just a person. You have
Beyond.
to look at what it is overall. You
Mm-hmm.
have to look at what it is they're presenting, what it is their issues are. You don't know who's going to save you later on. I give this, I'm known in the clinic for saying this. You don't know at the end of the day, if you something were to happen to you, you don't know if it's a black, white, blue, green, red, yellow person that's coming to save your life. And at the end of the day, you have to treat everyone the way you want to be treated. I
Right.
tell people my clinic is very diverse. My
Mm-hmm.
clinicians, I have non African American, I have Asian, I have Hispanic, I have every really. I think we united way over here. We
Mm-hmm.
got different, and I tell them
You
just
have
as
to.
much as you work with the next person, you also have to do that with your patients.
Right.
I said, so I love the diversity in my clinical team because
Right.
it also allows my patients to feel comfortable because there is someone that looks like them when they come in. And
Right.
just like how you respect your colleague, you need to respect your patient.
Hello.
Just as much as you're mindful with the jokes and the communication that you do with your colleagues, same thing with your patients.
Right.
So I teach them is what I overall I tell them treat people the way you want to be treated.
Mm-hmm.
You want people to respect you, you have to respect them. People don't know your barriers and all of that, but you move in a respectful and professional manner. Same thing with your patients. They're people, they have feelings, you have to treat them as such.
You have
So
to.
I'm very big on, just because of what I've gone through in the hospital and not being able to climb, and not being able, because of me, they
Mm-hmm.
kind of held me down. I'm big on it. I'm big on, you have to treat everyone fairly, and you have to treat everyone well. And if you feel that you cannot get through, you have to bring it to my attention. And I tell them, I give them that door. If you feel like they're too ghetto for you or they're too African for you, bring it to my attention. Let me help you. I'd rather you tell me, like, Dr. T, I don't really feel comfortable because I feel like I can't connect. Let me be that person. Let me come in into that session and help you bring that gap together. And I tell them that as the owner, as a director, that's what I do. As a clinician, that's what I do. Let me come in and help you. If you don't ask, I don't know, and then I feel like you're doing it on purpose. But if
Mm-hmm.
you come to me and
Mm-hmm.
you're honest with me and say, Dr. T, I just can't, like, we just don't gel. I come into your session and be like, what's going on? And sometimes I talk to the patients. I'm like, hey, sometimes you're being a little too hard on them.
Mm-hmm.
Sometimes patients they be coming for my clinical team, and I
Right.
have to tell them, like, they don't get it like I get it. They say, oh, Dr. T, I just want you understand. No, you have to be able to talk to anybody, because
Mm-hmm.
what if your PCP or your mental health provider doesn't look like me? You still got to get the care that you need.
Right.
So I do it on both sides. I do cultural competency also on my patient side, and I make them be comfortable talking to non-African Americans, because you don't know who's going to help you down the line. So
Right.
it's a lot of work, Dr.
Right.
Johnson. It's a lot of
Right.
work.
I love that. Thank you for sharing that. Therapy
Yes,
in me, please said treat them like they are your family member.
you have
Exactly.
to.
Exactly. Dr. T, okay.
Yes,
Each of my interviews, I always like to incorporate some aspect of mental health, okay?
yes.
Especially within the Black and Brown communities. I just don't want to only talk about it in the month of May. I want to talk about it year
Oh,
round. I
yeah,
want to talk about it every day.
absolutely.
We have to, okay?
Absolutely.
It's always easier said than done, and it's always important to hear what other people are doing or hear about other people's journeys, okay? So,
Hmm.
you know, I ask all of my guests, what do you do to stay on top of your mental health, Dr. T?
Hmm. Oh, child. Oh, look, if I'm not mentally healthy, I
Mm-hmm.
can't be physically healthy.
Mm-hmm.
If I'm not physically healthy and mentally healthy, I ain't healthy for nobody.
Okay.
So me personally, there's some days where I just take a random day off during the week.
Mm-hmm.
It's not even planned. If I wake up and I'm just like, I'm overwhelmed, I feel like, okay, I'll give you this month. This month has been, ooh, child, overwhelmed to the max, right?
Right.
I'm onboarding clinicians. I'm making sure the clinic is good. I'm bringing, this is the end of the year. So everybody's getting in, trying to get their last
Mm-hmm.
few therapy sessions in and all of
Mm-hmm.
that. So it's been like back to back to back to back. I already have a date where I'm like, I'm cutting off my phone.
Mm.
Nobody can talk to me. And I am actually getting out the house and maybe going to a spa day by myself where I am by myself. Because me being at home is not a break. Because then I got to clean. Then I got to pick up. Then I think I got to cook. Then I think I got to go to the grocery store. I feel like I'm still doing stuff and it's not a
Right.
true break for me.
Right.
A true break for me is I'm really just excluding myself from everything.
Mm-hmm.
The clinic knows, oh, if I don't answer by like 11, 12, oh yeah, she's not answering for today. Y'all need to figure it out because
Mm-hmm.
I need to
Mm-hmm.
be in a good mental space in order to lead appropriately. I have to
Mm-hmm.
be in a good mental space in order to give good care to my patients. I have to be in a
Hello.
good mental space to be a good wife, to be a good mother, a sister, a
Hello.
daughter, and so much more.
Hello.
Right? So I really just find something and I disappear for the day. That may be the day I go do my lashes. That may be the
Mm-hmm.
day I go to get my manicure, pedicure. That could be
Mm-hmm.
the day that I go eat by myself. I love to eat by myself. I love going to the bar, sitting at the bar, talking to random people that's not really, I don't want to say that's not going to stimulate my brain, but it's just chit chat.
Social chit chat,
You
right?
know, chit chat. Some days, if I can't do all of that, y'all, I may go to a park and just sit in my car and just meditate for like 10 minutes
Mm-hmm.
because I also have a toddler. So as soon as I'm walking in the house, as soon as I'm driving on the driveway, my
Mm-hmm.
toddler is waiting for me at the door. So there's some days where I'm like, you know what? I can't I need to offload what happened in the clinic. I need to offload what happened with my patients. I need to just sit with myself and gather my thoughts.
Mm-hmm.
I sit in my car, I pray, I may listen to some music, but I need to just kind of break away so
And
that I
reset.
can and reset so that
Mm-hmm.
others don't feel the brunt of what I was going through. So
Gotcha.
I believe it in physical therapy. I know you didn't ask me this, but I'm gonna do this.
Mm-hmm.
In physical therapy, if your mental health is not healthy,
Mm.
you physically cannot be healthy.
Repeat that again for the people then.
If
Repeat that
you
again.
are not mentally healthy, you cannot be physically healthy.
Mm-hmm.
If your mind, if you have so many blocks and barriers and issues going on here, and you're worrying about it, and you're thinking about it, and you cannot focus when I'm telling you to stand up. So I don't believe in mental health because it's May or oh everybody's mental. No, I believe in
Mm-mm.
mental health because I've seen it work in physical health. It works. I promise you guys, every dietitian, what you put in your body,
Right.
everything works together. So if you're not mentally healthy, you're not going to be physically healthy. And I push for mental health. I push for nutrition dietitian. I push for so much holistic care because that's going to be your best self. So
Right.
yes, that's my 2 cents.
I love that. Thank you for sharing that. Yeah, Sephiroth said
Absolutely.
mental health is every day, and Steph Shika said, and it works in nutrition too. It definitely
Absolutely.
does. And Dr. Henry chiming in talking about something true. She would know. She's a coach. She would know. She's a subject matter
Absolutely.
expert. Therapy me, please. I
Absolutely.
see you. So, Dr. T, thank you so much for taking the time to step into office hours. Okay, I'm not
Absolutely.
gonna
Oh, do
close
they
it
say
there.
clock that?
Yeah, we have one last question. I just want to
Okay.
thank you. Okay, because this was great. You did great.
I hope
This was
so.
great, and you messaged me, and you were like, Dr. Johnson, what direction? And I
Yeah.
let you saw my response was brief.
Yeah. Very brief.
You saw my
And I said,
response was
got it.
yeah. You saw my response was brief, but you knew you were in good hands. Okay, and
Yes,
you did an
absolutely.
amazing job. Okay, I just want to
Thank
make sure I
you.
reiterate that to you. I want to start doing that to my interviews because I don't
Yes.
do that during the interviews, and they always message me
Mm.
after. Did I do good or did I answer what you? So I just want to make
Right.
sure I say that you did a great job. This was great. This
Thank
was
you.
informative. And how do I know that? The chat was engaged. I received it, but
Yes.
the chat was engaging and the chat
Thank
received
you
it as well
all.
too. Okay.
Thank you.
So
Thank
to
you.
end it off, you know what I'm about to ask you. To end it off, Dr. T, what
Yes.
what is your overall why? Your overall why as it relates to the work that you do in healthcare.
Mm.
Your overall why as it relates to you being a wife, a mother. That's a whole
Mm.
separate. That's two jobs. A wife is a
Yeah.
job. A mother is a
Child.
job. Okay.
Child.
Thank you. I appreciate you. What is Dr. T's overall why?
Ooh, that's a loaded question.
Right.
Because funny enough, my brother and I were just talking about it this morning, and he asked
Mm-hmm.
me if I enjoy what I do and why do I do what I do.
Right.
And I think for me, it's just thank you so much. For me, I feel I see the future. I have loved ones, I have children, I
Mm-hmm.
have, friends, and so forth. And I feel that the future is the key. And I feel like we have to make sure the future is good.
Right.
I almost feel like I wish I could do more. I almost feel like I don't do enough. I do a lot,
Mm.
but I feel like I'm not doing enough because I'm so fearful of the future in the sense
Mm-hmm.
that do we have the right care? Do we
Mm-hmm.
have the right knowledge? Do we have the right everything that we need for us to be healthy and for us to be whole? And I look at, I'm going to get older someday,
Right.
and what do I want for myself? And if I want, like I told you earlier, I believe what goes around comes around. If I
Mm-hmm.
want good for myself, if I want good for my husband and for my child and for my loved ones, I have to pour good. And if God has given me this, the health hub is God, because
Mm-hmm.
I had a thought, I shared it with a friend and I said, I don't know how I'm going to do it.
Mm-hmm.
And that same day, she said, you got this. Like the way you've spoken to me, if you speak that way, I'm telling you. And when I tell you that same day, God just took it. I believe that He has put me in this position to
Mm-hmm.
further His kingdom in different
Mm-hmm.
ways. Right. So I do it for our future. I do it for you. I do it for me. I do
Mm-hmm.
it for all of us. Right. And
Right.
at the end of the day, I do it to glorify God because He has
Amen.
given me knowledge, wisdom, and understanding. He has given me this platform. And people are like, oh, don't mention God. Look, He's in everything that I do. Because
Hello.
without Him, I'm nowhere. Without Him, I
Hello.
wouldn't even be sitting here with you, Dr. Johnson.
Okay.
Right? So I do it because He has given me this and I can't sit on this gift. I have
Mm-hmm.
to share my gift because then I believe that He will bless me more and He will bless others. So
Mm-hmm.
I appreciate you for this opportunity.
Mm-hmm.
Like I said, I'm always on the other side.
Mm-hmm.
So
Mm-hmm.
it's nice to be on this side, right?
Right.
But
Right.
I do it because I believe in people. And I believe that if we're healthy and we're whole, then we are well. And I
Right.
want us all to be well.
I love
So
that.
I try,
I
yes.
love that. Thank you so much. Once again, Dr. T,
Absolutely.
thank you so much for being here. Thank you so much
Thank
for dropping
you.
these gems. Thank you so much for dropping these resources. And also, I
Thank
want to,
you.
Dr. T and I would like to give a round of applause to the chat for getting us to 100K
Absolutely.
likes.
Yes.
Over 100,000 likes. This
Wow,
this is the
wow,
third
wow,
time I've
wow.
done that, so that's monumental. So
Really?
okay, I started doing this with two, three people in the room,
That's it. Look,
and
but
now my
God.
room is getting 100K likes. So I appreciate you guys. You guys, this I hope you guys see I'm a genuine person. I'm a appreciative
Absolutely.
person. I come on here
Yes.
just I repeat this all the time because I have to remind people it's not the clicks and views and all that for me. It's a resource, it's information.
Mm.
But it's also good to see, hey, look at the analytics, look at the statistics. This
Yeah.
is telling me the people them are liking this. The
Love it.
information is resonating with them. So I want to
Yes.
make sure I start saying that the accomplishments. And as you guys know, it's never to boast and brag. It's always to
Mm-mm.
motivate. It's always for a representation. Okay. Dr. Johnson has over 100K likes in his room. If he could do it, you can do it too.
Absolutely.
Okay. Dr. T,
Absolutely.
thank you so much.
Thank you
We're gonna
so
be in touch.
much.
You know I do conferences. I
Absolutely.
do conferences every month, so
Yes.
I would love to include you in something that fits your niche.
Absolutely, absolutely.
Amen.
And
Okay.
I want to thank everyone for the gifts. Thank you for the
Right.
taps. Thank you for the love. I'm new and I shared out and some of my people came in and I
Mm-hmm.
truly, truly, I don't take it for granted.
Me neither.
This is not the crazy topics, but this is an important topic.
Hello.
And I truly appreciate y'all taking your time to be here, listen, engage, learn. I hope you guys learn something
Learn
from
something.
us. But this is a great platform. I thank you, Dr. Johnson. I can't say thank you enough. I'm glad you were my first on
Mm-hmm.
here
Mm-hmm.
because you're so passionate and I'm
Thank
so
you.
passionate. And I
Exactly.
think it just works. And this
Exactly.
collaboration definitely works. And I hope to be back because
Definitely.
I love
Definitely.
what you're doing. I believe in what you're doing. And
Thank you
I
so
truly,
much.
truly support you. Renita, thank you. Everyone, thank you, thank you,
Yes,
thank you.
thank you
Like,
so much. And shout out
y'all
to
are
everybody in the
amazing.
chat. Yes, thank you so much. Misty, I'm gonna let you go because you have a husband and a house
I
and
do.
a pitney to go home to. So
I
let me let
do. I
can we
know.
get a couple round of applause in the chat for Dr. T before I drop her down?
Thank
Can we get a
you.
couple
Thank
round
you.
of
Thank
applause in
you.
the chat?
Thank
A
you.
couple
This is
round of applause in
awesome.
the chat for Dr.
You
T
guys
before I
are
drop her down.
awesome. Thank you. Thank you. Thank you guys so, so, so much. That you'll be back.
Okay, yeah, yeah, definitely we'll be back.
Yes,
She
yes.
knows that because
Thank
look,
you.
she was a couple of them were
Absolutely.
back too. Dr. T, thank you so much. We're gonna be
Thank
in touch,
you.
okay?
We will. Thank you so much.
Okay.
Have a good evening. Bye,
You too.
y'all.
Okay, you guys are amazing. Thank you so much. Once again, thank you so much for over 100 likes. Excuse me. Gotta say it correctly. 100,000 likes. I appreciate you guys. So now we're gonna wrap it up with Professor Tips. Before I get into the Professor Tips for today, I don't know if Pals is still in here, but Pals, I had a conversation yesterday with Pals, and Pals inspired me for this Professor Tips. Okay, I don't know if you guys were on her live yesterday, but we had a conversation. It was myself and another creator on here, Miss Tanya. Now we were just having a conversation with pals and just not to put too many business out there if you weren't there, but just words of encouragement, words of affirmation, and words of motivation. And sometimes, like I always tell people, you just need to hear that. You just need to hear some motivation, some words of encouragement to keep going or for that reset. Okay. So she already, pals, I see you. There we go. The professor tips for today is updating your resume. We're wrapping up 2025. I know we all want to wrap up 2025. This was a year. This year was wild. Wrap this shit up. Ooh, wrap this year up. Okay, we want to wrap up 2025, but we don't want to wrap up 2025 without updating our resume because we want to apply to new jobs. We need new jobs. We need the money. We need the guala. Okay, for my Haitians, we need the jouet. Okay, updating your resume. Okay, Dr. Henry said definitely well, ma'am. So the first tip: target one role at a time. On your resume, we want to make sure we are targeting one role at a time. Frame greetings, welcome on in. We just wrapped up a great interview. I'm so glad you made it to catch me. I appreciate you. Thank you so much. We're just doing professor tips, briefly running through it. The first one is target one role at a time. And what does that look like? Tailor your resume to a specific job type. I have my notes written here on the other screen. So if you see me looking away, that's what I'm doing. Okay. Y'all need new jobs. I need new investments. Steph Shika, I don't know if I've been saying your name wrong throughout the whole time, but okay, I feel you, I hear you, I see you. You talking about some y'all need new jobs and you need new investments. Done with this economy. Hello. Hello. What's good? Let me get professional. Target one role at a time. We have to make sure that we are tailoring our resumes to specific jobs. What does that look like? Are you applying to a project manager job? Put project manager at the top. Let them people know that, hey, I'm a subject matter expert in what? Project management. Next, lead with a strong keyword aligned summary, not no 5-paragraph essay APA format, not no all of that. Give us 1 to 2 sentences, strong, concise, straight to the point. A 2 to 3 sentence summary that matches a job description, it will increase the application tracking system, aka the ATS. Okay? 3, use accomplishment driven bullet points. Use accomplishment driven bullet points. What does that look like? Use the CAR framework. I call it the CAR framework. What is that? Challenge, action, results. I'll repeat. Challenge. What was the challenge? What was the action? And what was the results? Okay? Next, quantify everything you've done. Quantify everything you reasonably can. Okay? It's still got to make sense. Quantify it. Employers love numbers. How are you going to be an asset? Numbers equal credibility. What did I just say? Employers love numbers. Numbers equal credibility. So revenue impact, percentage of improvements, cost savings, time reduced, volume handled. Let them people know that you are efficient. How? By showing numbers. And what does that do? Credibility. Hello. Make sure you take a note. One more thing. Keep it concise. We're going to end it here. Keep it concise. We don't want 3-4 pages. Keep it concise. Frame greetings in the chat said know what the numbers mean. Yeah. If you're going to finesse, make sure you know how to finesse good and do your homework and do your research, okay? I do need to do my homework stickers. Last one, keep it concise. 0 to 3 years, 1 page. I'm giving you examples now. If you have 0 to 3 years of experience, you need to have a 1-page resume. What you got 3-4 pages for? To let me know what you did in high school? If you have 4 to 10 years of experience, 1 to 2 pages. Let's do 2 pages. If you have 10 plus years experience, still 2 pages. What you telling them people all your whole bibliography for? Yeah, not biography, bibliography. Them people don't need to know all of that. Then people just need to know that you are an asset to their team or their organization and you bring value to them. They don't need that in 4 pages. Let's keep it concise. Okay? Steph Shika, we're not in high school no more. Okay? We're big. We got big jobs. Okay? This was a good, I don't know if I'm going to continue doing it like this, how I'm leaning and I'm closer to you guys. This was different. But I think today's conversation needed me to be closer to you guys and lean in. That's why I did that. Dr. Johnson is always intentional. Dr. Johnson always is thoughtful and think things through. I like that. I may do this again, be closer to you guys. Sefakor, I see you. I appreciate you. Briefly, one more time. Professor Tips, updating your resume. Target one role at a time. Lead with a strong keyword aligned summary. quantify everything. Keep it concise. You guys keep it concise, please. Keep it concise. Okay? Before we wrap it up, do I have my flyer on here? As you all know, for the new folks on here. Oh wait, Frame Greetings was saying stuff, but do you need to add more details to the application because they base conversation on my flyer on here? As you all know, for the new folks on here. Oh wait, Frame Greetings was saying stuff, but do you need to add more details to the application because they base conversation on the application? Frame Greetings, it sounds like I may need to bring you back. Frame Greetings, we've had a couple of conversations, and I think you've been itching to come back to office hours with Dr. Johnson, and I kind of had an idea. So these comments in the chat, I'm going to save them for you to come back and drop these gems for Dr. Johnson, office hours with Dr. Johnson. Okay? And Frame Greetings also said, anyone in the chat know anything about Medicare cost reports? I see what you're doing. You poaching in my chat. You are poaching in my chat. Frame Greetings, if you all don't know, she is an artist, okay? But she's also a healthcare professional. And she's trying to recruit. I'm not even trying to put your business out there, Frame Greetings, but you're in a position where you can recruit. I'll repeat that one more time. Anyone in the chat know anything about Medicare cost reports? You hit up Frame Greetings. Let's continue. Oh, I was looking for my flyer before I let y'all go. Class is about to end. Office hours is about to end real quick. I just want to just give myself a quick little shout out. You guys, December 16th, next Tuesday, 7:30 p.m. For the new folks on here who don't know, I host monthly conferences. Every month is a different theme, a different topic, and different guests. For the month of December, my conference is Minorities in America, a Public Health Issue. It's going to be big. Minorities in America, a Public Health Issue. I have 4 great speakers on here who are coming to share their acquired professional skills and knowledge as it relates to public health, as it relates to healthcare disparities that us minorities face here in America. This is going to be next Tuesday, 7:30 p.m. So next Tuesday will not be an office hours. It will be a conference. My blessings, I see you. You said you were locked in. Frame Greetings, we're going to talk. I may need you to bring you back. Steph Shika, I see you. I'll repeat the title one more time. Minorities in America, a Public Health Issue. We're going to be discussing a variety of different topics. It's not just one topic. And you guys are going to be surprised at what is a healthcare disparity or what minorities in America face as they're trying to access care. It's important. We have to talk about these things. Once again, minorities in America, a public health issue. We're wrapping it up right there on time. I appreciate y'all. Y'all are amazing. Deuces. Can I get a couple deuces in the chat before I let y'all go? Couple deuces in the chat. Y'all did amazing. I see you. 109,000 likes. I appreciate y'all. Couple deuces. What my deuces? Okay, Frame Greetings. I see you. Dr. Henry, I see you. Hey, we wrapping it up. Yes, I am Jamaican. Can we drop some Jamaican flags in the chat? Drop my flag in the chat real quick for me. Just drop the flag real quick. We good. Have a good night. My blessings did it. I see you. Mandy did it. Dr. Henry did it. Frames Greeting did it. We good. We good. We good. I'm gonna get a deuces stick. I gotta do my homework. I'm always telling y'all to do your homework. I have to do my homework. I have to do a stickers on the deuces. I gotta do a stickers on lean in because I'm always telling y'all to lean in, and I gotta do a stickers on I do my homework. My blessings. Have a great night. Thank you so much for being here. Christina, please get out of here. Y'all, Christina's my cousin. Please, Christina, get out of here. Everybody, thank you so much for being here. Have a good night. We didn't lean in tonight. I know. We're going to lean in next Tuesday. Oh, we're going to lean in next Tuesday. Hey, we're going to lean in next Tuesday. We're going to lean in next Tuesday. Christina, Professor does have homework. Deuces, everybody.